So one of the issues that we're facing now in the era of DAAs is to think about drug-drug interactions. Previously with peg interferon ribavirin, there were very few drug-drug interactions, but as the DAA program has developed, it's been clear with telaprevir and boceprevir that we do need to really think about this because both telaprevir and boceprevir can inhibit certain enzymes in the liver and therefore alter co-medications. They can also lower the effect of some other drugs, and therefore you might need to have a dose increment. And this can be really complicated. And so for a practicing clinician to get to grips with the many potential drug interactions, we've developed a resource which is a website, www.hepdruginteractions.org. This website is a sister website to one that has a longer heritage, which is an HIV drug interaction website, which started out some 10 years ago and has now got a database of 9,000 interactions and is used worldwide. So the Hep drug interaction site is following along, in a sense, using the same type of functions and the same basis that one can go into the website and enter the DAA, telaprevir, boceprevir, and then the therapeutic class, be it an immunosuppressant or an anti-lipid drug or a calcium channel antagonist or an antibiotic, and find out if there are data, and if there are data, that will be there. If there are no data, then there are a team of people who try to give some estimate as to whether there is likely to be an interaction or not. And it's done on the basis of traffic lights, which is red, contraindication, amber, be cautious, but it's manageable potentially, or green. At this moment, we don't think there's likely to be an interaction. Now, the resources are also available on downloads to Android and iPhone and iPads. And at the present time, 3,000 to 4,000 people are using the website on a regular basis, and many people have downloaded the resources and can use in the clinic. So immediately an issue arises, they can actually go to the downloadable form or go to their computer, and they can and be able to see whether or not there's data there to support their management of that patient. So all the time it will need to develop. As I said before, with the HIV site, there are 9,000 cells. With the Hep site, it's constantly being built to meet the needs of an international development program of these drugs. And as DAAs and the whole hepatitis C field goes forward with new drugs coming in, we don't think it's going to get any easier. We think that with the drugs that are following on telaprevir, boceprevir, the so-called second generation DAAs, there will also be drug interactions that we'll have to reckon with, and that is going to be the challenge, to maintain the database with all the data so that there's a real clinical utility. And the kind of phrase which I've used is that we need to arm ourselves, ARM, be aware, use resources, and then manage. And the whole aim is that we manage our patients and optimize their therapies.